let's start this roundtable on AI. We know that AI is transforming healthcare by driving advancements in personalized health, in precision care, enabling tailored treatments and interventions based on each patient's unique genetic, lifestyle, and clinical data. This wonderful panel will delve into how AI is reshaping the patient journey. And I will start with Dr. Vidya, asking her, how can AI enhance patient diagnosis and treatment specific to individual genetic profiles?
Yeah. Good afternoon, everyone. Thank you for having me here to discuss this important topic. Thank you, Dr. Fernando. So AI is transforming how we diagnose and treat diseases, particularly when it comes to the genetic profiles, because it enables to analyze the massive amounts of genomics data along with clinical metadata to identify specific disease patterns that would be almost impossible for humans to detect alone. And I would like to discuss some important topics here. The first is like diagnosis, treatment, pharmacogenomics, drug discovery, and preventive care. So let's first dive into the diagnosis. AI is enabling the diagnosis using the genetic information. For example, it can help to identify predisposition or any genetic mutations in specific conditions like cancers or cardiovascular diseases or genetic rare diseases. For example, AI tools like deep variant or CRISPR-based models, they enable identifying specific mutations, utilizing the individual's genetic profiles, and then identify hereditary cancers or any other rare diseases. So this means patients can be diagnosed early enough, even more accurately using these technologies, sometimes more often actually even before the clinical manifestations of the symptoms. And then when it comes to the treatment, of course, AI is transforming how the personalized medicine is helping to tailor individualized treatment plans. For example, in platforms like IBM Watson for Genomics, it analyzes tumor genetics data and then it will provide specific treatment strategies, even utilizing the clinical trial data and also enabling utilizing the protein expression data, genetic variation data, and so on. So utilizing individual genetic profiles, we can actually advance the treatment. And another exciting area is pharmacogenomics, where we can identify with the help of AI which drugs perform better in an individual depending on their genetic profile. Best example here is adjusting the dose for anticoagulant warfarin, where the metabolism of the drug is specifically related to the genetic profiles. So in this way, we can avoid adverse drug reactions and then increase the efficacy of the drug. And then another important aspect is drug discovery. AI is accelerating drug discovery. For example, companies like Benevolent AI and DeepMind, they are trying to utilize gene targets for introducing novel therapies. The best example here is the cystic fibrosis, where it can pinpoint the mutations in CFTR genes. So this means that we can have better treatment plans with more efficacy. And finally, AI is also helping preventive care by integrating this genetic data into lifestyle data, environmental influences. AI can actually predict who would or who might develop diseases even before it happens. So that means, we can warn the people to change their lifestyle, and then we can have better prevention, or we can even delay the process. So overall, in my opinion, AI is not just helping to understand the genomics data, but rather it is acting as a catalyst to advance the precision medicine. So with AI, we are moving closer to the future where medicine is as unique as the patient it serves. Thank you.
Thank you, Vidya. It's amazing how AI and genomics data can go beyond human capabilities and support us on this. I would like to go to Dr. Laila and ask her, how do you think that AI can play a role on predictive analysis for early disease and for prognosis? But then we talked about a lot about data and genomic data. It's a very special area where we need to be careful. I would like to ask you, how can laboratories be ensure the ethical use of patient data on these applications?
Absolutely. Thank you very much, Dr. Fernando, and good afternoon, ladies and gentlemen. Thank you for having me. So the laboratory plays a very important role in generating data about individuals, and it is such a powerful tool, really. The problem is all this data is sometimes could be overwhelming for physicians to interpret. Besides, there is always what we call the encrypted data that one of the previous speakers talked about, which is the data which is not kind of readily available, or we can actually understand it as physicians. However, the machine can look at all of this data, including the encrypted data, and start producing patterns that relates to certain diseases if they know the outcome. One very interesting study that was done on the UK Biobank, and this is a cohort of people who were followed in time, and their healthcare outcomes were there, as well as their laboratory data. And they looked at what are the drivers, or what they call accelerators, for some people to kind of die early, develop disease early than others. And from very simple tests, and by applying AI algorithm, they could actually identify those drivers that can accelerate aging or risk of disease or whatever in individuals. And these algorithms were as accurate as even the conventional tests that we use, like DNA methylation or telomerase length or whatever, to predict accelerated aging, etc. So definitely AI has a role to play in this space, and I think it will be really a very important role in the future.
Thank you, and I'm sure it will. Now I would like to come back to another topic here, and I would like to ask Carlos, that he has some experience on this. How can AI-powered wearable devices that we see more and more into our lives, and that they allow us to have the real-time monitoring of our health, how can healthcare systems integrate this kind of insights into the clinical practice today and eventually in the future?
Thank you very much, Fernando, and good afternoon, everyone. So that is actually a great question, because, of course, one thing is to have a very good AI model, eventually even using wearable technology and having both of them working together. The other thing is actually deriving value from it and integrating into the healthcare environment. So there are a few steps and a few guidelines that we can follow to integrate successfully this AI and wearable technology into precision care in a way that captures value. So the first one, of course, is a kind of interoperability between the model and the outputs of the model and the workflows that the clinician do. So this can be the electronic medical record, etc. So they need to be able to access the information at their fingertips, at the point of care, and this is, of course, extremely important. The other very important thing is that you need to deploy this kind of technology, you need to train the AI models, but you need to train the humans as well. It includes doctors, it includes nurses. So everyone needs to know exactly, they need to look at the AI insights that we receive, and they need to know exactly how to interpret them and how to do it. The third thing is that you need to provide clear guidelines and protocols if you have, for instance, a predictive model. This is extremely important, also to give this to people. Fourth, you need to focus on actionable insights. So I need to get information from AI that is information that is useful and that I can do something about this. Then you should think about other things, like, for instance, empowering patients. So patients should be able to access also data, output from the AI models in order to change their lifestyle, to keep a track of many things. And then finally, of course, we need to take if we plan on integrating this kind of technology widely in healthcare, that many institutions are doing, and we are at the forefront. Of course, you need to look at also data issues related to data security and to data privacy that are also very important.
Thank you, Carlos. If we go around on this exhibition, we see AI everywhere. It's amazing. So something is changing completely now on AI. And we heard, and thank you for your answers, how AI can change things, how data analysis can be changed with support of AI, how laboratories are adapting to AI or genomics. But I would like to ask you, Vineet, do we still have technical barriers and challenges to overcome in order to harness the full power of AI for personalized medicine?
Thank you, Dr. Fernando. First of all, it's an honor to be sitting with these clinical champions and precision medicine experts. So I'll give the operational and technology side of it. To the question that you asked about the challenges, I would make it a three-pronged approach. So on the challenges, the first is the complexity of the data. The second is interoperability. I heard Dr. Carlos touch on that. And the third is adoption, because you have interdisciplinary people in a company. So let's go back to the first one, the data. How complex is the data that a healthcare service is dealing with? If you look at a patient, there are three categories of data. 60% of the data that comes from a patient would be through their lifestyle, nutrition, environment. Some people call it the exogenous data that comes in. So that's one. The 30% of it is genomics data, what that patient was born with. And then the 10% on an average is your EHR, your medical history data. Now, this is overwhelming. As a healthcare service, are you going to go for all of it or some of it? So that's your first challenge. Let's say you are able to figure out which segment of this data I go for. The next challenge is interoperability. You have so many business applications, you have clinical applications, you have the data infrastructure. What's floating in between all of them? You cannot have siloed systems. So you want to make sure that the IT landscape that you create in your hospital or your healthcare system, the data can flow in and out across these systems. Otherwise, it doesn't matter, even if you capture the right data, if it doesn't flow freely across the systems through applications, etc., you don't harness the full power. The third challenge, let's say you have overcome the first two. Now the third is, how is it generating the outcomes? So that's where it comes to adoption. This is where it's extremely important to get the right stakeholders in the room at the right time. And that straddles across clinical champions, your data architects, your business architects, your IT leaders. You need to have a very tight group of people who can huddle up in a room, have a cadence of discussions so that, all of these hard work that the company does, it leads to a well-defined outcome.
Thank you, Vineet. And I will stay with you. And I would like to ask you, do we already have a playbook on how to effectively apply AI to transform healthcare system? And if so, what is it?
Awesome, yeah. So yes, I would definitely suggest a playbook. And the reason I can say with some level of conviction is because M42 has adopted a playbook within their AI powerhouse or the huge health network that spans not just within UAE but across 28 other countries in the world. So let's start from the playbook. The starting point should be not AI but your KPIs of the company. And typically, let's take example of M42. Their KPIs is very similar to many others. It's your operational excellency, it's your patient engagement, it's quality of care. These three are huge pillars. Now, you don't want to boil the ocean and take AI in across the board. Go quarter by quarter, go year by year, focus on some of these KPIs and get the jump in your numbers, right? Now double click down. How do you get to improving your KPIs? So again, the challenges that I spoke about, get the right stakeholders, figure out the right type of data to capture. Do I get the exogenous data? Do I get the genomics data? Do I get the health history data? So peg on some of those. Now, go on the application side. Get the right application architect, your partners like Microsoft and others in the room. Make sure you have the right EHR systems, the right clinical, and get it as standardized as possible within your company. Get the data cleansed, get the data standardized. Then you start empowering free flow. Once you do this, then in parallel, now you get to the AI techniques. So in AI, there are one or more approaches. You either start with predictive modeling, classification. These are what's called the standard machine learning techniques, and they are still useful for clinical operations and other. So again, it tied back to the AI. How much power do you want to give to AI? So these are well-defined ones, and you can employ quick products built by partner. You can do either of those. Now next, you go to generative AI. Do you want conversational interaction in your organization for call centers, for even for clinical ops people? Do you want to replace certain parts of the workflow with AI? Now the next forefront, as you guys are hearing, is agentic AI. Do you want your AI to not just have conversational, but you want it to start making decisions and controlled decisions, with the foundation of patient safety being applied? So there is a level of how much budget you apply, what capital you have, and how futuristic you want to go to. You need to play with your knobs carefully, and that's when you arrive at your playbook.
Thank you. Now we have the rules on how to do it. Thank you so much. Before opening to the audience, there is one question I want to make to Dr. Laila, because I really would like to know that. Maybe I need it. Can AI leverage laboratory biomarkers and diagnostic test results to be used to accurately estimate biological age and individual overall health status? And how can we use that in preventive care and population health?
Thank you, Dr. Fernando. I believe yes, the answer is yes. We are actually in discussion now with one great company that is just doing this. And they have masters an AI algorithm that can predict biological age. And basically, what we used to do in the lab is that we have all those fancy tests that we do to measure actually biological age of individual and see how that differ from their chronological age. But now, because of AI applications, and again with data training and so on, we can actually predict the biological age of an individual from very simple tests that can be done. And it's such a powerful message to give to patients or people in general, because they get all of a sudden shocked to learn that their biological age is actually more than their chronological age, and why is that, and what can I do about it? Or vice versa, if indeed the biological age is less, and maybe you're doing something good, and you should just continue. So I think it's going to be a very interesting field. On the population health, it is going to have a huge role to play, because you can all of a sudden look at, if you apply it at the population scale, if you have, for example, electronic medical records such we have at Malafi, for example, and if you were to apply this and try to understand the healthy population of Abu Dhabi, for example, and what exactly is happening there, it can really scale very nicely and give you insights about population health in general.
Thank you, Dr. Laila, and you can be sure that I will do that test and have a nice surprise from my side. Now I would like to open to the audience we still have time for a question.
Hi, hello, this is for Dr. Laila. I am Dr. Ahila. I just want to know, there is a very high burden of the genetic diseases in the region, right? So is there any tool M42 is developing for genetic diseases risk assessment using AI, something like that? Because it's very difficult to diagnose the rare disease, to reach to a differential diagnosis, as there are 10,000 plus rare diseases. Is there something you guys are doing?
Yeah, absolutely. I mean, the Emirati Genome Project that M42 is leading is one of these tools. Yeah, so to understand exactly what are the genetic disorders that are prevalent in our community. But not only that, so the team took this tool to the premarital screening as well, to screen young couple about to get married for common they are rare, but disorders that could actually be present in our community and what to do about them. So definitely genome and insights into the human genome can pave the way for this.
No, I just want to understand, like before genomics, to reach to a differential diagnosis of the genetic disease from the symptoms. Right. Is there something like from the symptoms you are identifying, yeah, these people are at risk of developing certain diseases, then they are needing some kind of genetic test, then we'll move to a genetic testing.
Yeah, absolutely. I mean, this is what we were talking about having, the lab data and certain predictors in this lab data that can predict this individual is at risk of having this condition or not. We also have certain studies that we do, for example, on patients who, say, develop cancer or whatever. We study the molecular characteristics of this cancer. So we do like a molecular profiling of that cancer to start to try to understand why did they develop this cancer, and we also test them to see the predisposition.
So just real quick, 10 seconds.
Time for a final question.
Hi, hello. My name is Dr. Varun Dwarka. I'm actually part of a diagnostic company in the States. We use a lot of AI, but one of the questions that we always get is how do you explain why those numbers are coming out the way they are? So how are you dealing with explaining the values that come out of it, the explanatory AI bit?
I will ask Carlos to answer this, please. Do you mind?
Yeah, sure. So
very short.
Very shortly, explainability is a big thing. I mean, I am with you. We as medical doctors, it's not enough to have an AI model say, so I recommend this treatment, or you probably should not get married because AI says so. Okay, this is not comforting. So we really need a degree of explainability, and this is very important because it enhances trust, it supports decision making, ethical concerns on that one, and also on precision medicine because it highlights exactly what it is. Now there are several strategies. I don't know, Dr. Laila may expand a little bit on how they are using, but usually for predictive models you can use something like a SHAP value chart. Okay, this is something that it's very useful. It's quite technical, but that it tells you what is the impact of each one of the variables in the final prediction. Okay, so this is something that you can use. You can also use individualized measures of the model performance for that patient in a group of similar patients. That can also help. These are just two strategies, but of course, explainability is usually very important.
Thank you very much. We need to end this discussion because we're running out of time, but they are here to answer the more questions that you have. Thank you so much. I think it's been fantastic, and we really have a new reality in front of us that will change the way we practice medicine. Thank you so much.